All right, I'm here with Dr. John Davila. This is Naota Hashimoto from Trackstat, and I get a lot of questions about compliance, and I've seen him at conferences speaking, and I have clients that use them, and just figured that I just pick him down and ask him a couple of questions. And looks like you put together a new Medicare series, Medicare 101, and yeah, just tell us a little bit about yourself and kind of
Oh
how
yeah.
you got into compliance and created this course.
Oh yeah. Compliance. Oh geez, I was a fragrance chemist in New Jersey in the 80s, 90s, and had someone do something that was totally non-compliant, and it almost lost my eyesight. So I had something blow up in my face. You know, when you're in school, you have the Pyrex that you work on, right? And it's in school, it's always brand new stuff because they tell you if it's scratched or something or faded, it's bad. You got to throw it away. And of course, schools have all this money. So I worked for this lab that made a whole bunch of things like Arm& and Hammer, right? The
Yeah.
deodorant. I worked for the group. We actually made the essences for all their rug and room deodorizers. So we would make the actual essence and then patent it and then sell the patent to Arm& and Hammer is what the one of the programs we worked on. Anyway, so we had this big separatory funnel and I'm shaking it. And I had told the people beforehand that it was bad and it was chipped and it was broken, need to be replaced. And so I had this boiling hot balsa wood oil and I put sodium chloride water in it and it went like this, boom, boom, and it blew up in my face. And I woke up about maybe 15, 20 minutes later with the fire department holding my face down in an eye wash.
Yeah.
So yeah, so acetic anhydride is acetic acid, aka vinegar. And so acetic anhydride is acid without the water. So as soon as my eyes started to tear up, my eyes started to burn. So, because it would turn the anhydride to acid, and it was like having like pure, vinegar poured right in your eyes. So yeah, so I went to the emergency room and got all checked out, and everything was fine. So I mean, that was when I realized at that point in time that like compliance is kind of important, right? It's like, oh, maybe we should listen to these people that say you should throw away these actual these useless pieces of Pyrex. But I ended up going to chiropractic school after that, and then graduated from Palmer 94 and ended up in a place where I got an audit letter, but it wasn't because I did anything wrong. I got an audit letter because they just blatantly, you build this code, they send a letter out. And I actually went back to Blue Cross Blue Shield of South Carolina and said, hey, listen, like, why are we getting this letter? And we ended up with in a conversation with the head of the legal for Blue Cross of South Carolina. And within that conversation, she realized that Blue Cross was wrong, and I had a letter from the state board saying I could do this service, and they agreed. And so they said, okay, well, we'll let you get away with it. I said, well, I have 3 or 4 friends that have the same exact letter. So are you going to make them go through this process? You're just going to, ignore the letter. You know that your rationale for this audit is incorrect. I mean, you really shouldn't make them go through this process as well. They're like, oh no, we're going to make people go through the process. I said, well, listen, and these are people I went to school with, I graduated with, that were now practicing in South Carolina. And I was like, well, if you do that, then I'm just going to go to the state newspaper and say, you're messing around with state health plan money and you know that this audit is incorrect and you don't care. And they're like, okay, well, give me 10 minutes. You left and came back. Okay, we'll go ahead and we'll basically delete the entire letter. We'll annul the entire letter for everyone across the state. So I went back to the state association and said, listen, this whole letter that everyone got a letter from, because I was a member at the time, it needs to go away and you don't have to worry about it. It'll be deleted. It'll be annulled. So you don't have to worry about it. And from there, I got on the insurance committee. Like, oh, good, you're hired. So from there until like maybe 18 months, and I just got on the boards on the state association's board, and then became president, and then all that different stuff. And really started working was I actually ended up being appointed to the Care Advisor Committee for South Carolina. So the Palmetto GBA CAC board member. So from there, I wrote South Carolina's LMRP, which is their payment policy, and trained their nurses and doctors in the state for close to 3.5 years before I got off that board. And learned a lot working from the inside and understanding what they were doing. It was a massive thing. So a lot of my education on what is required isn't because I took a class or got some certification. It's because I actually worked within the group and said, this is what the problem is. These are what our doctor's problems are. This is what you're saying the problem is. Why do you think, how do we fix this? And then understanding what they wanted, then going in that direction, and then helping doctors and training doctors. And that started the whole teaching seminars across the country stuff. So yeah, it's been a long 31 years since graduating from Davenport. So it's been a
When
long
did you
21 years.
get out of practice?
I started practice in July of 94, and I sold my clinics in 2007. So
Cool.
right, July 2007, July, September, October, somewhere there. Um, in
And then
2000,
like you've made a number of courses and like so the Medicare specific one, like obviously like I see in forums, like everyone's always asking questions.
right.
So like how did you come about this one? Like why did you create this
Oh,
specific course?
you know what? But it's the funniest conversation because there's so many people with opinions, right? So there's all this noise that takes place over here about what Medicare is. And then there's this simple data that's right here, right? So the noise doesn't never, if you ever like, when you go look at any of those questions, don't you ever go, all right, if someone said this is what it is, how can you have a differing opinion? Because Medicare is not about opinions, it's all about policy. It's references. Like, what's your reference? And the stuff I read, I don't even get involved. I see it online and I'm just I'm like, no way. I'm not getting involved in this. Because when you try to explain to people what the rules are, the conversations go out the window. This is not what I heard. That's not what I was told. I've never done it that way before. And when I tell you, listen, I'm not giving you an opinion.
It's right on
I'm
CMS's website.
This is what the reference is. And so I started to actually come across this until one day I'm teaching, actually one day, it's last December, I'm teaching in Atlanta for the GCA. And this guy comes to me and goes, do you have anything that I could actually have my CA watch? And I'm like, well, and it dawned on me like, oh no, I don't. I have all this stuff for clients in like snippets of different things, but I don't have anything specific to what Medicare is. So from that day until probably about a month and a half ago. So that's been December, January, February, March, April, May, June, July. So 8 months. I've been researching, recording, producing, and having everything edited professionally to be able to create a program that actually lays out every step-by-step piece, but not from the standpoint of this is what John feels. It's like as you look at the screen right here, right, is the actual reference. So John's talking and it's the reference right here.
Yeah.
That's it. There is no, because
There's no
there's
hearsay.
yes, there's no here. You can't have that. That's how you end up. And I'll tell you why it became so important. We were having a conversation. This takes me back to probably 2002. I'm working with the head of the Medicare review, the chiropractic review section for Palmetto. And we were told from as when we went to a care advisory committee meeting in Washington, D.C. with the ACA back in the day, one of the people talking at the group said, okay, box 14 is every time that you do a reeval. Every time you do a reeval, you change box 14. So I went back to the medic. I was like, oh, okay, fine. So we started implementing that into what this SCCA was teaching. Okay, let's do that. And then all of a sudden, one day I get to the Carry Advisory Board, Carry Advisory Committee meeting, and I'm like, this is what we were told from someone at CMS who was a reviewer. And they're like, no. And she does this. She goes, okay, now you see, here's the policy, here's the rule, this is what it means. Oh, okay. So it was wrong the entire time. Yes, 100% wrong the entire time. Okay, no problem. Got it. So we'll teach it this way. She's like, exactly. And I ended up in the best place in the world. I ended up teaching all these seminars in South Carolina for South Carolina doctors 3, 4 times a year, straight Medicare seminars with the head of provider outreach sitting next to me on the stage.
So you got
So
like a lot of videos on your thing. Like, are there two or three things that you feel like they have to like, or
yeah,
obviously they follow in a sequential order, but like some kind of a teaser that a CA would learn from this?
yeah. So the first one is that like the idea of what isn't like what produces an audit is the number one thing. I think that's assuming like I'm going to assume people realize you can't opt out of Medicare. I mean, if you want, I could put that one first as far as like who has to be involved. I mean, that obviously, that's a couple of videos that would explain the whole thing. But the idea of what actually like what's box 14 and what is an audit would probably be the biggest thing. That those would be the biggest ones because the whole idea of like I'll put it this way, you're always a target, right, for an audit. It just matters how much ammunition you give them to find you and shoot you down with. And that data, that ammunition, is everything that's on a claim form. So when you send in a claim form for a patient, you have to make sure that what you're sending them makes sense. So you have to look at things like, how far away am I from my box 14 date? What's my frequency? Those videos on how a care plan impacts your profile is the most massive thing. And then the other one that I would make people watch is one that's not necessarily one that people would think, but I think is so important. I have a video that talks about the rationale for the reviews of the 2015 OIG review of chiropractic documentation. In there, there's a statistic that you will love this. And it says if 80, I'm sorry, 80, I always say this wrong. 68% of your codes are one code, right? So if you have a choice, different levels, 99401 1 or 2, if 68% are the same code every time, that's the threshold to what they considered it might be fraud.
Yeah, it's kind of interesting when you start looking at data in an aggregate way, it becomes really obvious. So like now that, TrackStat, we have like now like a couple thousand plus people log in and using it every day. Like picking up those outliers is so easy. It
Easy.
just like it is so easy, but like you don't think of it when you're sitting there, but
Oh,
like there's so many things that are just now obvious to me about practice management that wasn't obvious to me. It was like hearsay. It's just, yeah, so it's just really interesting. And it's just data, right?
oh, it's just black and white, right? So watch this. So I don't know if people watching this may not be interested in this, and that's totally fine. And that's why people hire me to do this kind of stuff. There's a website called Fierce Healthcare. They're basically a data aggregate, a news gathering organization for healthcare. And one of the articles from May, this is what it says. CMS, I have it pulled up right here because I actually did a review on it for a video, which I'll release to my YouTube channel coming up this week. CMS sets up real-time medical fraud center with Doge. Federal contractor rolls out commercial tool. That commercial tool, you combine those two things together, that commercial tool is a tool to go ahead and look at claims as they come in. So the real-time fraud center actually cut out $46 million in one day of bad claims that were going to get paid just on looking at the data as they rolled in that day,
Catching
not
it before the checks are written.
before the checks are written. The one thing the federal contractor rolls out, here's what it's called. You ready? It's called Rapid FI, Rapid Fraud Intelligence. And look at what the article says. The article says here, it's not currently used by CMS, right? But perhaps the most obvious agency they're the most obvious agency that could benefit from the offering. This is what the guy from Rapid FI says. It's 50% faster than a regular review, and the return on investment is 100x. You ready?
Yeah.
Here's the best part. Notifications alert investigators to suspicious billing patterns or activity through a probability risk score. Providers are also judged against each other through comparative billing, allowing investigators to see how one provider's billing stacks up against the rest of the pack. They're
Yep.
just going to go ahead and hit the high nail.
Yep.
That's it. And the data is the data. So if you're all 99401, just prepare yourself. And that's the reason why now I go into, even when I was teaching this weekend in Augusta, the whole idea of teaching a seminar has nothing to do with about documentation, has nothing to do with taking notes. This is the most important component. So even when I teach, the most important videos, are the ones about how do they track me? Because we like the funniest part about this note is when you are actually how can I put this? When you drive, a lot of people you use Waze, right? So they can go around the traffic, so they know exactly where to go. Yet if I say to them, listen, don't you want to know what you look like before you bill insurance? They're like, I don't care. What difference does it make? It's like, no. I have good documentation. Like, no, it's not about your documentation because it's
You don't
possible.
even want to be looked at.
No, exactly. And plus, don't forget, it doesn't even matter what your documentation says. How many times would a visit be never payable no matter what you write down?
Well, and they have industry norms. It's kind of like if you're a restaurant and you're reporting no cash, they know that I'm making up the number, like 20% of payments are in cash. Obviously, that might be changing when some places go cashless, or if something is 100% cash, you might be the mob, right? So, like laundering money.
Yeah,
So,
there's a couple different ways that it goes out there, but that whole number of having one particular code be the number you use all the time, people don't realize. That's how crazy this can be if you don't pay attention to what you're doing. And that's why Medicare isn't about the notes. Medicare is about you understanding what you bill first. So I think, people go, what would be the coolest thing to talk about? Your care plan. What has your care plan affect your profile? Like, what are the three things that would trip an audit wire? The percentage of use of 989-401 and 2? Massive. The frequency that you see somebody once a week forever, definitely coming to get you. If you're talking about, how far away you are from your box 14 date. If I'm 9 months away from my box 14 date and I'm still billing active care, that means that in reality, if I go to
well,
the screen here, that I've been doing this the entire time, going up and up the entire time with no questions asked.
when I was an associate, they just changed box 14 every month.
That's it. See, that's another one of those three card money shell games that they go ahead and they change. Like it's impossible that every patient every time has the same problem that changes every patient every time.
Yeah, well, I didn't know the rules back then, and when I got
Oh,
off on my own and started looking into it, it's like, oh, and I just went to seminars and they just say you can't do that. And I was like, oh, I didn't know that.
yeah, exactly. Yeah, because it just it resets the clock. Well, it does. If you have
Yeah.
a new, it does if you have a new problem. Exactly.
So,
That's the kind of stuff I'm talking about. That's the reason why people may think that I would say I have a cool way to take notes. It would be all about the profile. Those would be the top 4 or 5 videos that I would have people watch.
so I got to put a link to your page. So, like, to take advantage of your Medicare offering, like, tell me, like, what do they do? Is
Yeah,
it a
yeah. Go to
subscription or like a one-time
It's a
purchase?
one-time thing. It's a one-time thing, and there's a difference. You can buy just the videos, or we have a compliance program that goes with it, with training videos and everything else that goes with that too. The video series is 72 videos on Medicare alone. But what the difference is, what we've done is we've actually referenced every video. So I'll give you a great example. So what we did was on each video, let's see, I hit the wrong button there. There we go. We actually recorded each video, and I'll show you a quick screen share here for you. So here's what we look like on our website. So right here, what we did was we actually referenced with live links every reference. So now you watch the video, it's 4 minutes and 46 seconds to watch why you can't give away free services. And here is one, two, three, 4 live links to references. So that way it's not John's opinion. That way you can take this to the staff and say, here's the rule, here's the policy, do it.
Do you have kind of like sample scripts to help explain it in a simple way to patients?
Yes, we actually record those videos as well. They're
Okay.
all in there. Yep.
Yeah, because like sometimes some of the Medicare people, they're not 100% with it. So like
Right.
need it very
Right.
simple.
Yeah. So we did that mainly because what we wanted to do was actually stop this conversation about, well, I don't know who to believe.
Yeah, it's right there, right
It's
on
right
their
there.
site.
And it's 70 videos that, and right now we're in post production for the compliance manual as well. So if you guys want that, there's $100 off the program, and whoever gets that, it's called Tracks, and you get the coupon code, which I'll go ahead and show you guys a little bit.
And then you sent me a QR code.
I
I'm
did,
assuming you're
yeah,
gonna do a link too, right? If they
yeah.
want to just
I'll do a
access
link
it from
to,
their computer.
yeah,
Cool.
here, and the answer to your question is right here. So what we did was we actually came up with a code for this, a QR code. Put in TrackStat 100, just go right to there, and we'll $100 off, and I'll upgrade you to the full blown program with the compliance training and compliance manual, the whole entire thing, editable compliance manual. So save about 50% off the whole entire product. So that way you guys can go ahead and get not just the Medicare stuff, but also get the compliance program going in the right direction. Now, obviously there are people out there telling you that it's mandatory. It's not mandatory, but it's something that you should have. And it
It's like
does help you.
pre-insurance, right? Like it's a lot cheaper than an attorney. Like, like I've
That's,
gone through compliance stuff. I've hired attorneys afterwards, and
yes, we've talked about that. Yes.
it's definitely a lot cheaper
That's
than
a
an
lot
attorney.
cheaper. That
Yep.
was a lot. Yeah, exactly.
A lot less of a headache. So like we only got a couple minutes left here. Like any last words or anything you want to share with people before you go?
Yeah, I think especially within your group, because you know the stats, this game's a little bit easier to go ahead and digest. So the people who know what you do and the people who are really attuned to the statistics, all they really need to do is know how to be able to handle it. I honestly believe that I don't teach people anything about the clinical side of practice. I don't teach people about how to treat patients. I don't do any of that stuff. It's just what to do with the data. Like, what does this data mean, and how to be able to make yourself compliant because you have that data. Most people, and I think that you deserve a little love here as well. Most people don't realize the data that you give them, right? So people outside this program that outside of what you do, they don't realize how powerful the data is that you're allowing them to see in real time. And this is a great example. Not knowing the utilization rates of what you're using, if you know those numbers, you can make adjustments. If you don't, you're not going to be able to change because by the time you get the letter, it's too late.
Yep.
So
That fraud AI thing's gonna catch you.
yeah, the front AI thing is just going to come right out, and it's just going to come right to it and really get people to hopefully stand up and pay attention. I hope. But until then, the only way to do it is to be out front of it and fix it before it goes. But you do a good job giving people that data.
Cool. Thank you very much for coming.
You got it, man. Thanks
Take
a
care.
lot. Take care. Bye.